Welcome back to the Physician's Guide to Doctoring. On this week's episode, we have a guest host, so please be the same respectful audience you are for me and enjoy.
This episode is brought to you by Heidi. Imagine kicking back while a HIPAA-compliant AI scribe writes your soap notes for free. Yes, you heard us right, Heidi is free. I'm Dr. Tom, Heidi's CEO and founder, and we started Heidi to stop clinicians wasting their life on clinical documentation. Heidi transforms your consult babble into crisp, clear soap notes, personalizing itself with every edit. One day, Heidi will be your AI resident, looking through research, explaining plans, and doing anything you don't want to. If you currently pay for an AI scribe in your practice, you should swap to Heidi. We'll even credit you for anything you've already paid. Dive into the description for the link and make your practice the envy of every stethoscope in town. Sign up and watch Heidi work its magic, all for free, because you've got better things to do.
This is your guest host, Dr. Cobin Soelberg, a private practice anesthesiologist. Today I'm talking with a colleague and friend, Dr. Brian Doody, who's a professor of urology at Oregon Health and Science University in Portland. I brought Brian on today because I wanted to talk about some of the really cool non-clinical stuff that he's been doing in the last couple of years of his career. He's currently running for a state representative position and has a really great non-clinical role with strategic outreach at his university. And I think it's really inspiring for all of our surgical colleagues, but all of our physician and medical colleagues as well. So please join us as we talk this evening.
Hey, this is Brad Block, host of the Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle.
All right, thank you for joining us. I'm your guest host today, Dr. Cobin Soelberg. I'm a private practice anesthesiologist and a financial planner out of Bend, Oregon. And joining us today is Dr. Brian Doody. Brian and I are friends. We've known each other for 10 years or more now. He's a professor of urology at OHSU in Portland. He's also the director of the Office of Strategic Planning, which we'll be talking about today. And just recently, last time we caught up, he told me that he was running for a state Senate seat. So there'll be a lot to talk about today. So welcome, Brian. I'm glad you're here.
Thanks, Cobin. I appreciate the opportunity to get to chat. And it's good to see you in person. It's been a little while. So yeah, thanks for the opportunity.
Of course. Yeah, it's great to see you too. I was thinking back, and when we met, you were thinking about doing an MBA, and then you started that program, and it seems like it's led you along this path. So what was it like getting the MBA as a surgeon, and what sort of support did you get from the university, and what made you want to do it in the first place?
Yeah, I think like a lot of things in life, it was quite a bit of chance. And so Jason Hedges, who's a colleague of mine, and I got dinner with our chair, Dr. Chris Amling. And, as our department was expanding, he made it clear he was going to need some increased support. And so he wanted one of us to be the new program director because our current program director was looking to step down. And then he wanted the other person to be medical director for the department. And previously, we hadn't had a medical director. And so we got coffee the next day, Jason and I said, okay, what do you want to do? And he said, I want to be program director. And so that's how I became medical director. And it became, very apparent, a couple of months into that position that I had no idea how to speak the language of an administrator, didn't understand any of the numbers. And so at the time, a friend of mine who was actually he's an anesthesiologist at a different hospital, but in the gym where I worked out at, said, hey, I'm doing this healthcare MBA through OHSU and Portland State University. You should look at doing it. And it's a healthcare MBA, and it was relatively affordable as those things go. And so I was dumb enough to say, sure, why not? Because I love learning like you, Cobin. And so I signed up for it, and it was fantastic and very, very, very challenging to try to balance with a busy surgical practice, which I had at the time, being the main person in our department that does mostly take care of kidney stones. And I was the only person in our department doing that. So trying to balance that with the MBA was challenging, but was definitely worth it. And it's actually kind of taken my career in a different path, which I would have really never have expected.
Well, and I love that, Brian. And I remember because we would try and catch up and you were always studying at night. I wonder, because it seems like whenever these opportunities arise in our lives and our careers, it's never the quote unquote right time. How did you decide to just sort of jump and make that leap of faith, even though you were, it'd be very easy to say like, my clinical practice is very busy, like now's not the right time.
Yeah, I mean, I think, at that point, I was about maybe 4 or 5 years into my clinical practice. And because I'm a surgical sub specialist, I was getting to the point where I was doing enough procedures where I felt like I was starting to get to the flatter part of the learning curve. And, I'm still learning, obviously, but I was definitely reaching that point of diminishing returns. And I knew obviously that I wasn't going to do these 2 or 3 procedures entirely for the rest of my life. And so I knew that I wanted to have a side hustle, so to speak. And as an academic, you're practicing at an academic institution, you kind of have to look to see what your interests are and what your strengths are. And my strength is not research. It's an area that is, critically important, but something that I'm not particularly good at. And so as a result, I knew it was going to be either teaching or more kind of administration and leadership. And so the MBA seemed like a kind of a natural choice in that direction.
For, one of the reasons I wanted to bring you on today, when we caught up a few weeks ago, you were telling me about your new role as director in the Office of Strategic Management. Did I get that right?
Strategic outreach.
And it was fascinating. And, a couple of things I wanted to ask you. The thing that I remember you saying was, having this new role made you feel a little more resilient. So if you don't mind talking about this new role, because I think it would be fascinating, especially for our surgical colleagues who are listening, who, often feel like they're just so busy to try other things, and talk a little more how that built resilience for you.
Yeah, these other things, even though my schedule is not necessarily better, I definitely feel more resilient. And I think that one of the things for me that really I struggled with was a lack of feeling of control or having some kind of agency or impact in the things that were negatively impacting my practice, but more importantly, negatively impacting my patients. And so that's kind of how I went down this journey. And so I did the medical director role for a while, and I really enjoyed it. But it was very much focused around, improvement within our department. And one of the things I noticed was that what was really starting to affect my patients the most was lack of access to surgical services at OHSU. And that was at the time kind of just pre-pandemic, but we were noticing a real crunch in the state in terms of our bed capacity. And I was having big delays in terms of getting my patients to the operating room. And so, I was really frustrated and I want to get involved. And so I started working or volunteering in this office called Mission Control at OHSU, which helps to kind of manage the capacity of patients across our small healthcare system. And I really enjoyed that because it gave me a lot more insight into why I couldn't just have more block time and why I couldn't get my patients immediately transferred. And so did I solve any of the problems? No, but I had a lot more understanding, and a lot more compassion for, what everyone was trying to do. And so a natural extension of that was like, okay, so, we're trying to maximize the beds that we have where we're at. And we've pretty much, done that to the best of our ability, but yet we still don't have enough capacity. And so if we want to try to take care of, people that, need better access, how do we do that by allowing patients to have more care in their communities? And so this Office of Strategic Outreach, it's a small group at OHSU, but basically we're kind of liaisons between the university and external health systems. And so myself and one other physician, we basically kind of travel around the state and meet with providers and leaders of various healthcare systems to figure out how we can partner to try to make sure that, only the patients that really need to go to OHSU or go to Portland need to go to Portland. And how do we leverage some of the skills that we have to allow patients to be able to get, access to care in their community? So it's just kind of this natural extension of challenges I was facing in my own practice around capacity, trying to approach that from a system, and then more of a statewide kind of role.
And if I remember right, now that's like 60% of your time. Is that right? So like your clinical role is only 40%. How's that been for you?
Well, it's all about timing. So like when I went to do the MBA, there was no way that would have been feasible because I didn't have a partner that specialized in the same area of urology. And then about 3 years ago, we hired a urologist named Ian Metzler, and he's fantastic. And so he does the same area of urology. He's really hungry clinically. And so I've been able to shift some of my volume to him. And, fortunately for our area of urology, you don't need probably a 2.0 FTE, you really need about a 1.5. And so this has, worked out really well. I mean, I wouldn't have had the opportunity probably 5 or 6 years ago to do it. So it's worked out nice. And it's a perfect blend, I think, in terms of, still in the OR at least once a week, still do some clinic, but then kind of doing more of these systems-based and statewide kind of things, which has been, like I said, has really contributed to my resiliency.
So what I'm hearing from you is, a lot of this, I mean, obviously it's timing, and luck's not quite the right word, but like being in the right place at the right time and being willing to say yes to things. What I'm wondering, because I can already hear in my own head and in our surgical colleagues' heads, well, like, yeah, that's all nice and good, but that's not going to work for me. How did you advocate for yourself, particularly within an academic setting where it feels like they always want to throw more on your plate? And where did you find mentorship, especially, for sort of the non-clinical stuff that you're doing?
Yeah, it's funny how you say that. A lot of it is kind of timing, but it really is about mentorship. And so I knew I was looking for like what was going to be the kind of the next step after I felt like I'd been medical director for the department long enough where I felt like I was comfortable in that role, but realized I wanted to have a more kind of institutional leadership position. And I applied for like this associate CMO position at a different hospital in Portland. And I was looking at a variety of different things. And a mentor of mine, of course, Matthias. So Matthias was like, I would just hang tight. I think there's a position that's going to become available that would suit you very well. And I was like, what position? He's like, I can't tell you. And then sure enough, it was like the strategic outreach position that became available. And so actually I deferred making decisions kind of based upon this mentor, this person that had been really influential to me. And I think the thing that's really interesting in life is you talk about, it's like so much of it is chance, and it's not only just like opportunities, but it's also mentors. And it's mentors that when you first meet them, you'd have no idea that this person 4 or 5 years down the line would have such a huge impact, and Matthias is one of those people. When I first met him, I had a little bit, I had a hard time reading him with his Germanic personality and everything. He's pretty intense in the ICU, and I just owe, so much to him. And so I think it's one of those things where it's just like trying to cultivate relationships and learn from them. And then you just never know also when they're going to, pay huge dividends.
I love that, Brian. And I think I think one of the important parts of that, I think probably the most important part when you're cultivating those relationships, it's not transactional, right? It's not like, what can you do? It's almost one just based on mutual respect and curiosity. And you really don't ever know, like you said, it's almost never immediate, right? It's not like you're going in and saying, hey, I need help with this thing, and it happens right away. It's kind of like what you said, it's something, it's like 5 or 10 years down the road where someone says, oh, I know the perfect person for this role.
Yeah, no, I kind of agree. I think early on in the department, we have some, kind of junior faculty, and they're, asking for advice. And for me, it's like, I didn't know what I wanted to do when I started. I mean, like I said, I knew I didn't want to do research, and I knew that I wanted to have an impact, but I had no idea. And so early on, I just said yes to everything. Oh, sure, I'll do this thing in the School of Medicine, some committee, or I'll do something in the OR management. And I had this really scattershot approach, but it actually worked out really well because it allowed me to make connections across the university in different areas, education, and then in the hospital. And this role of strategic outreach really is all about relationships. And so connecting people at other hospitals to the most appropriate person at OHSU to build these programs. So yeah, I think it's not transactional, but like you said, fast forward, 6 or 7 years later, those connections that you have really, really, at least for me, have benefited me tremendously.
Well, it's this concept of explore and exploit. And at the beginning, you need to explore a lot because I don't think any of us know, right?
Well, did you know that you were going to be doing all this financial work that you're doing now?
Like that's all of it is, like whether it was law school, whether it was doing the financial stuff, it's just, similar to you, like people come into your life and said, hey, there's this interesting thing, you should try it. And you say yes to a lot of things and you prune a lot of those things. And that's when you start exploiting. But I think that's what makes life interesting and fun. You kind of said it earlier, right? Like you can't imagine doing the same 3 or 4 surgeries for the rest of your career, right? And same for what I do with anesthesia.
To get the most out of your career as a physician, you need an employment contract that supports you. Unfortunately, most contracts do not initially include everything you need to be successful. Employers draft contracts with their best interests in mind, but the terms that benefit your employer are rarely as valuable to you. Before signing an employment contract, you should always make sure your salary, bonuses, paid time off, and other terms are fair. Resolve is the one and only place you can get live salary data, so you know exactly what's happening in your specialty at all times. The best part of the data is that it's verified from real physician contracts. With access to data on what physicians like you are earning, you know when you're being underpaid and can confidently ask for what you deserve. In addition to providing data, they're the #1 firm specializing in physician employment contracts. They work with every specialty nationwide. At Resolve, you get connected with an experienced attorney who will work with you one-on-one to ensure you sign with confidence. Your attorney will take your priorities into account, address concerns, make suggestions, and help you strategize for any negotiation. They can even negotiate with an employer on your behalf. So whether you're a seasoned attending or just finished training, Resolve is here to support you in every step of the way. Visit resolve.com to learn more and discover how to sign your ideal employment contract. Resolve, your trusted partner for physician contract review, negotiations, and salary data.
Let's shift gears a little bit, Brian. And, speaking of mentorship, you're running for a state Senate position, which is awesome. I'm very glad that you're doing that. I talked to you a little bit about how that happened, but it's the same concept, right? Of a really powerful mentor who used to be the Oregon governor and a physician. Talk about that a little bit.
It's very similar to the kind of the strategic outreach position that I got, with Matthias saying, hey, there's this opportunity you should think about. And yeah, similarly, I know I've always been interested in history. I've always been interested in politics, or what I'd like to say, public service. And so I always saw that at some point I would probably run for some type of office. I didn't know if it was state office or it was going to be local. I just knew that was something I was interested in. But once again, I kind of had envisioned that it was going to be in my late 50s or early 60s. And right now I'm 46. And I went to college at Willamette University, which is across the street from the state capitol. And at the time, Governor John Kitzhaber was either in his first or second term. And the cafeteria at the state capitol is terrible. So he would come across the street and have lunch at the cafeteria. And I remember having lunch with him a couple of times and got to meet him there, and just kind of followed his career. Obviously, he's a physician, also a really kind of moderate legislator and governor that was really popular. And then fast forward to this MBA program, he was asked to come and speak to our healthcare MBA class one evening. And afterwards, I cornered him. I was like, I've heard you speak a million times. I've had the biggest bromance on you for like 20 years. And at some point I want to run for public office. Can we get coffee? And that turned into I got coffee with him once, and then a year went by and I reached out again. I got coffee with him. But then as I got more involved I'm also really involved with the Oregon Medical Association on the executive committee. And then with one of the subcommittees for the Health Evidence Review Commission for the Oregon Health Authority. And as I started to get some more of those positions, he started reaching out more because he's still really involved in health policy. And then eventually one night I was watching Netflix with my partner Danielle, and sure enough, Governor Kitzhaber calls and says, hey, this position, actually the House of Representatives in your district, is going to become available. It's not been announced, but it's going to be available. Announcement's going to be in a few weeks. And if you are serious about running, I'd be happy to support you. And so this was like another one of these events where, had no idea that this was going to be something that, an opportunity would present itself. And so I spent some time. I talked to my boss, my two bosses, my clinical boss, Chris Amling, and then Jimmy Heilman, who's my boss in strategic outreach, and they were both very supportive. And so I just kind of took the leap. And so now I'm embarking on that sort of thing, And I would say, to your point, I think the human brain is really wired for novelty, and you get that little kind of dopamine rush every time you're doing something novel. And this is something completely different. I'm sure the work you're doing with financial planning, that was something that you hadn't necessarily planned, but has really, once again, been incredibly stimulating and has allowed me to learn a lot of things and meet a lot of people outside of just healthcare, which has been really enjoyable.
Yeah, it's so fun. I'm so proud of you. And it's really been cool to see where your journey has taken you. And I mean, it's sort of funny how, just when you're curious and ask questions and ask for help, it's amazing how many people are willing to help when you ask for it, right? In a genuine way of like, I have this question, or, I'm really interested in this thing. Most people are really willing to help, which, I think speaks volumes of the world. It makes me feel a little bit better about our planet right now. But it's amazing how far you can go when you just ask.
No, I completely agree. And I think, I'm sure that, you could rattle off the people that have really helped advance your professional and your personal life. And, it's hard to repay them. At least I feel like, there's not much I can do for, Matthias or Governor Kitzhaber or other people that have been influential, other than to try to do the same thing for people that are, embarking upon their professional career. And so, yeah, I always try to, no matter how busy I am, make time for, students or residents or junior faculty that are interested in to trying to take the next steps in, their professional careers. I don't necessarily have the answer, but I just kind of tell them how I stumbled upon, where I'm at, and also I will say the thing that I really like about this outreach role that I have at OHSU is it allows me to kind of know, a lot of people in the university, which allows me to connect other individuals who are looking to get more involved, who just don't have those connections yet to be able to help introduce people. So that's been really nice.
Thinking whether it's running for office or you're, this director of strategic outreach, what have been some of the challenges, like unexpected challenges of these, quote unquote, non-clinical roles? And I think, part of the reason I'm asking is I think for many of us, our clinical day, like we know how to get through it with like very little problem, right? Like, sure, things come up here or there, someone's late or a surgery goes, later than you expect, but how to like get rid of most of that friction. But this is like a whole new like business world, right? Like administrative world, which I think for many of us seems a little terrifying. So like, what are some of the lessons you've learned from working in those spaces?
One of the things is just, obviously having a panel of patients makes it challenging. And especially, I mentioned earlier, my main area of focus is, kidney stones, and obviously kidney stones. So right now my clinical schedule is I'm in the OR on Mondays and then I'm in clinic on Friday. Well, I have a large panel of patients that I've amassed over the last 12 years. And, they don't just get kidney stones on a Monday and Friday. And, and so as much as I would like them to, they don't. And so trying to figure out how to deal with these patient emergencies that crop up, or if I operate on a patient on Monday and Tuesday, I'm supposed to be going to the coast to meet with the leadership team at Columbia Memorial Hospital, and I have a complication that comes back. These things are all, challenging. So I would say that's been a big thing that I've struggled with. And early on when I was doing outreach, it was maybe about, a third, and my clinical practice was two-thirds. That was a little bit easier to balance. But I would say, it took me a while to figure out where you have like half, essentially kind of almost half clinical and half administrative, how to draw that boundary, And so I think I'm still trying to figure it out and how to kind of insulate my time most effectively when I'm supposed to be doing, my outreach job, and not let my clinical work bleed over into that. So I'd say that's probably been the biggest thing I've struggled with.
Well, and a corollary to that, like, how do you find time for yourself, for your relationships, knowing that neither surgery nor certainly running for office, like those are not things that always happen during business hours. So how do you carve out time for yourself and for the people that are important to you?
Yeah. I think, for me, just personal time, I really enjoy exercising. And so I do my best to try to make sure that at least 4 or 5 days a week, I'm able to go to the gym for an hour. And I try to exercise, vigorously enough that I'm able to just kind of clear my mind. And so I think I still try to prioritize that. That's one thing. And then in terms of my, relationships, I still try to make sure that like, tonight's going to be date night, or that we have a couple of nights in which, the campaign's not going to take center stage. So just really trying to do that, but I have to be more intentional about it. Whereas before, it was more spontaneous and it was just like, okay, I'm done with work, let's hang out. But now it's like really trying to schedule it, to make sure that time is available. So it just requires a little bit more, thoughtfulness, I'd say.
Well, and I love that work and that word intentional, because, as we talked about, I have a 2.5-year-old at home, and before it used to be, right, like, yeah, you get home, you're like, oh, let's work out or let's go out, or you didn't really have to plan anything because unbeknownst to you at the time, there was just so much time available to you, right? And now if I want to get a workout in, it's got to be at like 4:30 or 5 in the morning, which is terrible. But if I want to do it, that's when it's got to happen. And so I think of all the lessons I've learned probably in the last 5 or 6 years that have been most impactful is being really cognizant and intentional with your time and your attention to do, and I think like looking at your career, I think you can see threads of that throughout, right? Where you kept taking the next steps, even though you didn't know what necessarily the outcome was going to be, right? Like you didn't know where that final place was going to land you. You just kept saying, I find this interesting and I think this is interesting, and just kind of see where it takes you, which I think is fantastic.
Yeah. I mean, I think a lot of us, we think that we should have all the answers, right? That we should know in high school what we want to do and go to college and, we know exactly, or we go to med school and we know, I'm going to be a cardiothoracic surgeon or I'm going to be an anesthesiologist. But most of us, we don't have it all figured out. And so I think it's, trying to be intentional about making decisions that don't really limit your options. And of course, as we move along the course of life, I'm not going to be an astronaut, I'm not going to be an Olympic, athlete. You have to make choices that are going to limit your opportunities, but trying to do it in a way that, still allows you to have the most flexibility in where things go, depending upon your interests. And so I've really tried to have that kind of approach to making, I guess, from a professional standpoint, is this going to limit my options moving down the line? And if it's really going to limit an option, then I think a little bit more carefully about it. And I think that's one of the great things about really focusing on relationship building is that that's always going to open up options for you moving down the road, as opposed to like if you're like the angry surgeon who's throwing stuff, or if you're rude to, whoever it is, that's only going to limit your options, which you don't want to do. And then I think, kind of on a personal life or relationship side, it's really trying to be intentional about not necessarily my time, but, prioritizing time with those that are important to me. Whereas, as you said before, when you felt like you were busy, but you actually had a lot of time, you didn't really have to focus on doing that. And so really trying to be more thoughtful about, carving out time for that, I think's, been really important.
Awesome. Well, I think that's a great place to end. I love what you're doing. I love that you're representing your specialty so well. And I really hope this inspires other surgical or anesthesia colleagues to think outside the box and think about some of these different areas where they might be able to get involved in an administrative or sort of a non-clinical role. Because I do think, particularly in like surgery and anesthesia, I think we have a lot and we see a lot of different things in the healthcare system in different ways from some of our hospitalists and physician colleagues. So I love what you're doing. I hope you do really well with your House of Representative run.
Yeah, well, Cobin, I appreciate it. And I've really, it's been a little while since we've had the opportunity to connect, and it's so great to be able to spend the time this evening because, in many ways, I feel like we were going through the same journey together. We were both trying to figure out what the next step was going to be in our professional career. And I just loved, being in the OR front desk, running into you and saying, okay, so what's the plan? What are you doing? What do you think? I've got, I think I'm going to do this, financial planning for physicians, and just kind of your thought process. Yeah, which gave me inspiration to be able to think a little bit outside the box as well. And so thank you.
Well, I appreciate that. And that's, I think that's what's fun, right? Is you never know who you're sort of inspiring. So I think being the best version of yourself is really important.
Thanks again from Heidi. Elevate your practice with a free AI scribe, zero cost, HIPAA compliant, and time saving. Ready to swap? We've got you covered for past AI scribe expenses. Head to HeidiHealth.com, get started, and make your practice the envy of every stethoscope in town. Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it, or like it, or comment on a social media post, or write us a 5-star review. Something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice, or financial advice, or really any advice. Thank us again for listening to The Physician's Guide to Doctoring.